Okay, so our pelvic tilting from the seated position now is a progression of the pelvic tilting from laying on your back. And the difference now is that we have weight bearing through the pelvis as well as our spine stacked, supported upright against gravity. And so what you're going to do is you're going to give yourself a little bit of a hug through the shoulders here, just to keep your hands out of the way and stabilize the upper half of the body as much as you can. And then what I want you to try to work on is tilting the pelvis just like you were from your back, forward and down. If you think about the face of the clock, now the face of the clock is kind of tilting down towards the floor, and that would be arching of the back, and then flattening the back and tucking the pelvis under, so that now the face of the clock of the pelvis is up towards the ceiling. So focus 2 forward and backwards. The goal here should be that your shoulders and really the rib cage up are not doing a lot of movement forward and back. So if you're doing more of this, then you're compensating and not truly tilting the pelvis most likely. Again, focus on breathing in the end range. And then the other thing you can think about in terms of cues is if you feel where your sit bones are under the buttock on the chair, then you can also think about rolling forward and off of the sit bones and back off the back edge of the sit bones as well. And sometimes that's a good cue for people so that they can still get that sensation from the chair and get that tactile feedback. Give it a shot.